I know the umbilical cord stump might be your least favorite body part of your newborn baby, and that you're probably not very excited about having to take care of it until it dries and falls off. It also doesn't help that healthcare professionals don't seem to agree on what's the best way to do it. So, in this video, I want to give you all the information based on the most recent scientific studies that will help you care for your baby's umbilical cord. The first and most important thing you should know is, what is the point of umbilical cord care? Well, there are two goals we want to achieve. Number one, we want for the stump to dry and fall off. And number two, we want to prevent infection. The infection of the umbilical cord area is known as omphalitis and can be very serious. At the end of this video, I will show you how you can identify this complication. Since it is so important to prevent infections for many years, it has been recommended to clean the cord stump with antiseptics such as chlorhexidine or alcohol. But after reviewing numerous studies, it has been observed that using antiseptics might delay the cord separation, and that in high-income countries there is no higher risk of omphalitis if dry cord care is practiced, which I'll show you how to do in this video. Therefore, organizations like WHO and the American Academy of Pediatrics currently recommend for high-income countries not to use antiseptics and simply practice dry care. For families watching from other parts of the world, in low-income countries where adequate obstetric care can't be guaranteed and where the rate of cord infections is high, the use of antiseptics is indeed recommended. And the preferred one would be chlorhexidine. If you have any doubts about the situation in your country, I recommend you ask your healthcare provider. And now let's see how to perform dry cord care step by step. Keep in mind that the baby does not feel pain in the cord because it doesn't have any nerve endings. So don't worry, you won't hurt them. First, clean the area with water and neutral soap. Make sure that your hands are also clean before you do so. After that, very important, pat it dry well. Remember, we want to keep the cord stump dry and clean. You should change the baby diaper frequently as soon as you notice it is dirty. Some suggest leaving the cord outside the diaper or covering it with a clean gauze, changing it every time you change the baby. But there are no studies confirming that this is better. You can also just leave it outside the diaper without any gauze, and try to use baby clothes that are a little baggy so they don't keep rubbing the stump. You can repeat this procedure with each diaper change, although you don't always need to use the soap if it's not very dirty. And you will see that the cord stump is eventually detached between the 5th and 15th day of life. There are a few things you should watch out for, and in case you notice them, you will need to take your baby to a doctor. Redness or inflammation around the belly button. Wet cord with a very foul-smelling yellow discharge. These are both signs of infection. Bleeding off the stump. Sometimes there may be a granuloma, which is not a severe complication, but I think should be assessed by a doctor. Delay in the cord's fall beyond 15 days of life. And now, if you want to continue learning about how to take care for your baby, I recommend watching the Babies 101 playlist and subscribing to my channel so you don't miss on any new videos. Share with me in the comments how you've been recommended to take care of the umbilical cord stump and how did it work for your baby. Sending you lots of love and see you soon.